Are you dealing with SI joint issues or that muscle right above your pelvis on the side of your spine? I want you to try these.
This right hip, and I'm gonna push through the block.
Folding into it, I can grab this bench. I'm gonna push through my right foot, lifting my left hip. We're gonna start from this quadruped position. From here, I just want you to think about the relationship between your pelvis and your lower back. So I'm kind of holding a neutral spine position, and from here I'm gonna think about just going into a posterior pelvic tilt, pointing my butthole to the ground, and then going into an anterior pelvic tilt, pointing my butthole up in the air. From here, I'm just gonna go back and forth, just trying to get a little bit of movement between my pelvis and lower back. We'll get this for a couple reps, and then we'll start to work a little bit bigger up that spine into a traditional cat camel, getting high flexion curve of the spine, and then dropping back down into an extended spine position. Big reach up, same thing, thinking about tucking my pelvis underneath me, dropping back into a big extended spine position. From there, we're gonna go with an offset cat camel. So I'm gonna think about bringing my right hand in closer to my right knee, longer distance from my left hand to my left knee. From here, I'm gonna think about that same cat camel position of moving my spine through flexion and extension, but this time I have a little bit of a lateral excursion of my spine, adding a little bit of rotation as I get up high into this big flex position, reaching off to the side, and then taking it back down. Just adding an element of rotation into this traditional sagittal plane dominant movement. Making sure that we do both sides here. From there, we're gonna go to a Shinbox rotation. I think the lower back and the hips go hand in hand. So anytime we can add some rotation to those hips, really stress internal and external rotation of those guys, it's gonna help things as it leads up into that back. I'm even gonna add a stretch in sometimes, kind of loading that posterior capsule, adding some tension here, just flowing back and forth. Find it's a good recipe for the back to kind of touch on the hips every couple reps, every set, just kind of revisit a movement where we can load those external rotators, take some tension off that lower back area. From there, we're gonna go right back to that lower back, pelvic area, and I'm gonna go with a block here. I'm using a yoga block here. You can easily use a plate, just something to elevate the surface. And from here, I'm gonna place this block underneath my right knee in that same quadruped position. From here, I'm gonna think about lifting my left knee up, and I'm holding a neutral position. So now I got the same quadruped position, acting like a block's there, but it's not. And from here, I'm gonna think about bringing this left knee down, letting that drift happen, loading this right hip, and I'm gonna push through the block and lift my pelvis as much as I can. I want you to think about this almost as like a pelvic airplane. I'm just letting my pelvis move around the fixed femur of my right leg, pushing through and then reaching up. Really don't try to allow your upper body to kind of donate any movement here. Really try to keep the focus on that pelvic area, moving that lower back, moving everything together, just adding a little bit of a twist, reaching as high as we can, then reaching as low as we can. Make sure we get both sides here. Even if you're having problems on one versus the other, we want to address both sides together. Once I've kind of loaded that tissue with the body weight from that quadruped position, I'm gonna go back to a stretch that's gonna load that posterior capsule. So once again, from that quadruped position, and I'm gonna take my left leg across, almost thinking like a pigeon-esque stretch, loading that right external rotators on my hip, and then going right back. I'm gonna do one side at a time, but you could easily do both sides alternating. But I'm just thinking about loading rotation, loading those hips. As I sit my right hip down, I'm loading the right external rotators to this glute. I'll take my left elbow down to the ground to kind of load that wrap a little bit and then take it right back. Make sure we get the same amount of reps on each side, but once again, loading that tissue and then going back and forth. Sometimes I'll do this posterior capsule stretch and then go right back to that quadruped position, moving that pelvis. After I've moved that pelvis from that quadruped position, I'm gonna go up to my feet to get a little bit more of a lateral shift and load that QL area a little bit more. Then up to our feet with that same yoga block, I'm gonna add that same sort of concept. I'm gonna reach my left heel to the ground, loading this right hip, and from here I'm gonna push through my right foot, lifting my left hip up. So now as I reach it down and lift it up, I'm thinking about right now my pelvis is dipped. I'm gonna reach up, trying to lift my left pocket as high as I can while not bending over. I'm still trying to stay as upright as possible here, glutes underneath me, ribs over top of my pelvis, reach it down. I'm gonna kind of take my pelvis off to the side a little bit, slight bend in my right knee, maintaining the arch of my foot, push through that right foot, whole foot's on this block, lifting this left hip up as high as I can, and then going back and forth, letting it drift, letting it take me in, and then reaching it up as high as I can. I like to have a point of stability here. My left hand here is a balance to really allow me to focus on this right hip. You really might start to feel that QL area light up a little bit as we're loading into that tension, pushing away, adding some strength, lifting our body up, controlling what that pelvis is doing. Pairing that with another posterior capsule stretch, this time from an incline bench. You can also use a plyo box. I like the incline bench for the slant. And from here, I'm gonna think about slightly bending my right knee, kind of loading into these left external rotators of this hip here. And from here, I'm just gonna kind of reach across, really loading that left hip capsule. And from here, I'm gonna push my left knee into the bench. It's gonna propel my body up. And then once again, I'm just gonna kind of load down, bend that right knee a little bit deeper, really try to feel into this stretch. Sometimes I'll grab this bench and kind of pull myself in, load that stretch, kind of push away. With an incline bench, we have the opportunity of kind of rolling in, folding into it. I can grab this bench, and from here I can drive into it. I can push into this bench with my leg, kind of an isometric on those external rotators of that left hip. And then from here, letting go, pushing off. We're gonna do this for the same amount of reps on each side, no matter if you have a right or left low back problem, then going back to that hip hike, loading that pelvis. Next, loading that lateral line a little bit further. We're gonna go with a bench here. I'm gonna try to keep my elbow underneath my shoulder, even though it may drift away a little bit as I'm loading this tissue. I'm gonna go top leg is over the top. I'm on the inside edge of each of my feet. I'm trying to keep my hips forward so I'm not hiking back into my pelvis, trying to stay forward, abs tight. And from here, I'm just gonna think about dropping my hip in, really feeling that stretch. I'm feeling it along that right QL area or right lateral line, even a little bit even in my right hip. And from here, I'm gonna push my hips up, reaching my hips diagonally up to the ceiling. So I'm letting my hips drop into this angle, drop into the angle, keeping my elbow in tight, loading at length, and then from here, having strength at length, pushing up, driving through my elbow, lifting that hip up as high as I can. Dropping in nice and slow with control. I'm not plummeting here. I'm owning this change in direction, loading at length, hold it for a pause, pushing away, lifting, not a yank, not a lot of momentum, a smooth contraction out of it. Make sure we get both sides here. And I compare that with something like this. I got my inside leg forward. I'm gonna take my right arm here. I'm gonna kind of pin my right elbow to my side. And from here, I'm gonna kind of keep this right arm still. I'm gonna take my left arm, reaching up over my body. And from here, I'm gonna think about letting my hips drift laterally away. And I'm getting all that stretch and that lower back area, that QL area, and I'm gonna kind of give it a little bit of English. I'm gonna let my pelvis turn a little bit. I'm gonna push away. I'm gonna let it come back in, but just really trying to get as long as I can. We spend so much time being compressed so tight. Just getting some length, loading that length. You can grab a bar, a rack, whatever you have access to, but literally trying to go away. I don't want to be arching my back, and the same thing, I don't want my hips back behind me, getting as tall as I can. I'm thinking about squeezing my left glute here, trying to keep my posture nice and upright. Once again, my pelvis underneath my ribs, and I'm just kind of letting that length take me away as I push my right arm, as I try to get as much length out of the lats and that QL area on the left side as possible. Make sure we get both sides there. Or I could pair that with another posterior capsule stretch, taking my left leg up and over my knee, and from here just grabbing my knee in, pulling it up into my chest. From here I like to kind of like rock back and forth a little bit, kind of play with tension a little bit. From here I'll just kind of push my knee down, just kind of pry on that area, pull it up, maybe even lean forward some. Just trying to get as much tension release out of that left hip as possible, as seen here. Once again, hitting both sides, just kind of loading that capsule, pulling that knee in, sitting up nice and tall, loading those stretches, getting that posterior capsule stretched. Loading that area around that lower back a little bit more with these QL walks. From here, I'm just seated in this upright position, and I'm gonna think about picking my pelvic bone up, moving it back and sitting it down. Picking it up, moving it back and sitting it down. Nice and tall, picking it up, sitting it down, picking it up, moving it back, sitting it down, picking up, reaching back, down. I'm equally driving my heel into the ground to give me a little bit of tension to push back, reach it back, sit it down. Reach it back, sit it down. Pick it up, reach it back, sit it down. Reach it back, sit it down. And then pairing that with more movement. Going back to that Shinbox rotation like we did at the beginning, just kind of getting some movement in the hips. I can add a little bit of a fold, taking my elbow down to the ground, loading those external rotators a little bit more. I find that helps with that lower back area, that tension we can get created around that SI joint. Just really loading, reaching, getting a little bit more out of that area. Run through some of those. You can run through all of them together or separately, but it's that concept of movement, load it. Movement, load it. Come back to things. If something feels good, stay there. Stay on that movement. If something doesn't feel good around that SI joint area, skip that and try the others. I hope these help.